Hi, this is Dr. Nielsen. We're going to be talking about trach suctioning and trach care. So this is going to come to you in two parts, suctioning and then care. So when you suction your patient, this is a patient that has a trach, and so I just want to show you this person's trach. So they have their outer stoma, and then they have the outer cannula that's in, and then they have the inner cannula. And back in the day, all the cannulas used to be metal and smaller, and so that was the whole purpose of cleaning them all the time. But now we have these nice fancy disposable ones, so when it gets all gunked up, is that a word? All filled with phlegm and different things, these can actually be thrown and a new one inserted, which is nice. And so, but for the sake of showing you trach cleaning and suctioning, or cleaning, we're gonna actually clean one of these. But these normally on a normal time would not, they would just get thrown away, okay? All right, so our patient would have an oxygen source. We also always want to have an ambu bag or be able to give them extra oxygen to the site before we suction them also. We'd want their head of the bed up. We'd want to make sure that we have our suctioning equipment ready to go. So you would need a canister, you need a meter here for the suctioning. This actually doesn't turn, but you would want your suction 80 to 120 on the dial, okay? You really wouldn't want it much higher than that, okay? Also, the patient that has a trach, we always want to know what size trach they have. And so there's some examples, and while you guys are in here practicing, I want you to actually open these boxes and look at them. But this is an actual trach, and this is an obturator. It's called an obturator because if that person coughs that trach out, you as the nurse put on gloves, and you want to put this into the trach opening to hold that opening open, and so that way it doesn't start closing and that patient loses their airway until that respiratory team can come up and recannulate your patient. Some trachs have, and we're going to talk more about trachs and respiratory. Some have cuffs on the end that they're blown up, so they stay in place, and some are uncuffed. And so knowing if your patient has a cuffed or an uncuffed trach is very important, and what size. So like this one, I believe, was a size 6, okay? And then there's another kind up there too. So when a patient has a trach, they should always have a trach suctioning set up, the canister, the machine, suction machine. They should have an oxygen source, whether it's a trach collar, and they should have extra oxygenation, and they should always have a new trach for an emergency in the room, okay? And then if they're disposable cannulas, you would have supplies of the cannulas, and you would have supplies of the catheter, trach catheter suctioning kits always in your room too, okay? So it's always a good point to like think about going to get groceries on your shift. How many care kits do I have in the room? How many suction catheters do I have? So that way, because you never want to leave someone without it at the end of your shift or start of their new shift, excuse me. So introduce your patient, introduce yourself to your patient, ask your patient their name, birthday. We would want to, if we're going to suction them, these are 14 French suction catheters. They come higher than that. 14 is usually run of the mill. There's gloves that you would use. This is our simulated normal saline lid up. If you pour it or anything, you would want to hold it with the label. You do want to wear a sterile glove when you're suctioning. So first thing we'd want to do is we'd want to listen to our patient's lungs to see, do they really even need suctioned, okay? Because the more we suction, it will cause more irritation and damage to their lungs that they may not need, okay? To do the ambu bag, to give them a little extra oxygen, you can slide your trach collar over. This piece of this ambu bag actually fits over the top of that, and you would give them a few breaths and tell them what you're up to, okay? Take that off the patient, put their thing back on while you're getting everything else ready and set to go. Our dial is on 80 to 120. Okay, it's always the most interesting part. Getting those gloves on. Okay. So when you take this out, you're going to connect this piece. So whatever hand you're going to suction with, you're going to connect this here. Okay. Put your finger over the top and you should hear it showing that you got pressure. Okay. You're going to suck up some water by holding that to clear your tube. And then the best easy way to do it, guys, is with this dirty hand. You're going to come across here and you're going to go down. Okay. About 2 to 4, and then you don't want to force it down, but when you come, you don't ever hold this button when you go down because you're going to suffocate your patient. But when you come up, you hold your hand and you twirl your hand and just do intermittent coming out. Don't fling it out like that because you or someone else can be wearing phlegm. Put your oxygen back on your patient, clear your line, let your patient catch their breath for a second, and then you're going to suction them again. And you only want to do short passes, not even like 5-10 seconds at a time suctioning them, because it wears them out and takes away their air source. If you can get away with suctioning only twice, that's good. If not, let them catch their breath a little bit before you would do it again. Okay, so that's suctioning basically. So what size suction catheter did you use? How did the patient tolerate it? What kind of drainage did we get in the canister? Was it clear? Was it thick? Was it yellow? Was it white, frothy, wet, clear? And after you suction, always listen to your patient's lungs to see if they improved or not. Okay? So that is basically suctioning. So when you take this apart, guys, the best thing to do, make sure that all this tubing is not like near your patient where they can choke themselves on it, get it wrapped around their neck or anything. And then take this in your gloved hand and bring your glove over the top of it to secure it, to put it in the trash. Okay? So that's trach suctioning.